The family of Claude Lemieux says they will donate his brain to science. The Avs great died by suicide last week at the age of 60. His family says Boston University's CTE Center will use his brain as part of their ongoing research into long-term effects of repetitive brain injuries. They also point out they don't know he had CTE, right, but they said they are willing to let them share whatever they discover from this research. So we have Dr. Pyle Coley here to talk about it. This is something that's been thrown around a lot, especially with football. What does CTE stand for? What is it?
Such a devastating condition. So chronic traumatic encephalopathy. So exactly how it sounds. It's a chronic condition. It's usually due to repetitive head traumas, and it causes an encephalopathy, which is essentially degeneration of the brain tissue. So what ends up happening, and we think there's some magic dose of the number of hits that you have to get. Usually it's not just one hit. One hit starts it, but doesn't propagate it. But if you get multiple hits to your brain, subconcussive hits, it can create an inflammatory reaction in the brain that can cause these proteins to deposit and nerve cells to essentially die. No way to diagnose it, as you said, Kim, when someone is alive. Right. So really it's an autopsy diagnosis. You cut up the brain, look under the microscope and see these tangles. But we're really working on predictive algorithms, looking at scoring systems and proteins and such to see if we can diagnose it while someone is alive.
He died by suicide. Talk about the connection here, because most recently I think about an athlete like Aaron Hernandez, and died by suicide, and also had CTE. They said one of the worst cases they've seen. Is there a connection?
There is a connection. We're just trying to figure out exactly how it works. Is it causal or is it associative? So in other words, we know that having CTE increases depression, increases emotional instability, increases lability of your emotions, and we know that that increases suicidality. So A leads to B and B leads to C. So does that mean that A leads to C? That's question
the
option.
Transitive property.
Number one, the transitive property, you remember from school, yeah? Excellent. I'm impressed.
I don't.
If A equals B,
I'm glad you remember. I have no clue.
That's very good. But the second option is, could there be underlying genetic predispositions that predispose you to both? To get CTE and then to also have increased risk of suicidality? Because we know that not everybody who gets head trauma gets CTE, so there is clearly some genetic or other component to it that we don't understand.
So, I feel like it's relatively new, the way we've been talking about it, and a lot about helmets and young people. Like a lot of kids start playing football like 8 years old in the Pee Wee leagues and little leagues and stuff like that. And you worry about concussions.
Yes, you do, Kim.
Is that something researchers are looking at long term, all the connections?
We are, and what we think is that a younger brain is actually more sensitive in a way to the effects of CTE. So if you look at a study from Boston University, autopsy of athletes under the age of 30 who died, 40% of them ended up having CTE.
No. Wow. Yes. Wow, that's a lot.
So to me, this really does raise an alarm bell that what are we doing here? Why are we waiting for an athlete to start to have some of these problems and then saying, okay, maybe they have CTE, and then kind of leaving them unhinged? We really need to have an intensive screening program for young athletes, for any athlete who gets repetitive head trauma, to make sure they're not slipping through the cracks, and we're really watching them behaviorally, psychologically, physically, and making sure that we're keeping them on track.
So do you think with a connection like that and numbers like that, do you think that kids, when I say kids, high school kids and on, who are playing helmet sports, hockey, lacrosse, football, should they be monitored, watched, questioned in a different way because of it?
Yes, yes, and yes. And in fact, there's even some evidence that we should be using tracking helmets. So, for example, as doctors, when we go into a room where we're using X-ray machines, we wear a little radiation tracker on our collars so that we know anytime we're getting radiation, someone is adding up the dose. In the same way, shouldn't these young kids be having some sort of a head trauma tracker? Because we also know that if you get a head trauma, a second head trauma, when the first one hasn't healed, that accelerates the process of CTE. So if you're playing, high school sports, you get hit in the head, you shrug it off, you move on, you don't even really realize the impact, and then you get another one a week later when you're playing another.
When that one heals, it's easier to get a second, isn't it? Once
really
you've had one.
Yes, and it creates that susceptibility, and we start to see, like I said, these protein deposits in the brain that then create this collateral damage to other brain cells. Wow.
Well, it's important, and I applaud their family in this moment of grief from doing this, just in case there's a connection, hoping that researchers learn.
And I really want to emphasize that looking at the brains is going to help us learn so much more. Like we already have learned that the proteins happen in clusters in the brain. What does that mean? Where in the brain do they cluster? And how can we change the way that they're causing death of the neurons next to
The only
them?
way to do that is to look.
To look.
Okay, Dr. Coley, thanks so much.